Okay, so observing your abdomen, it is symmetrical with good musculature, and it is flat. There is a visible pulsation where your abdominal aorta is, which is normal. I am now going to auscultate in the 4 regions for vowel sounds. Okay. So vowel sounds were present and autoactive in all 4 regions. I am now going to percuss your abdomen in all 4 regions. Okay, tympany was heard in all 4 regions as well. I'm now going to put my hands on you. I'm going to lightly palpate at first in all 4 and then deeply. Do you have any pain or discomfort?
No.
And now deeply with 2 hands. Any pain?
Mm-mm.
How about now?
No.
All right, all set with that. I am now going to push on your right leg, and I want you to resist me and lift your leg against my pressure. Okay. Do you have any pain?
No.
Okay. All right. I am now going to briefly inspect your hands. Can you pass me your hand? You can sit up now. Okay. So looking at the back of your hand, there is no tenting present. Looking at your capillary refill, it is less than 2 seconds, which is good capillary refill. Can you put your thumbs together for me? There's a visible diamond, so that is no sign of clubbing or hypoxemia. Your skin is warm to touch and pink bilaterally, which is a good sign, all the way down to the toes. If you could just put your feet up here for me. Okay, looking at your legs as well. They're both pink with good musculature, equal in musculature bilaterally, and warm to touch on either side. You have regular hair distribution on both legs. For a woman, because you have shaved legs, I'm assuming, do you shave your legs?
Yes.
Okay. And there is no edema present. Okay. All right, and there are no lesions, or anything like that on your feet. I'm now going to move on to testing your strength just generally around your body. So I'm just going to palpate first the jaw. Okay, can you open and close? Okay, now I want you to push down with your chin or with your jaw. Resisting, good. Strength 5 out of 5, full range of motion. Take your arms, I want you to push up against mine. Okay, and down against them. Okay, strength 5 out of 5. And then can you generally move your arms, pat yourself in the back, go like this, grab your hands. Okay, so full range of motion, strength 5 out of 5. And I'm going to bring this chair back. Make sure we can see that. Okay. Okay, and I'm just going to take a look at your strength in your legs. So again, the knee joints do not have any redness, swelling, or bruising. Could you go knock knee for me? Okay, and then kick your legs out, back in, full range of motion. Now push your legs out against my hands. Strength 5 out of 5. You can see that? Okay. And now, if you wouldn't mind, I'm just going to check your reflexes. So I'm going to briefly hit your patellar. And this part is part of a neuro exam. Okay. So reflexes are present. They are 2+, which is a normal reflex, your patellar reflex. Just going to take a look at your pupils. Look straight ahead for me. Okay, so pupils, perla is intact, so they're equal and reactive to light, and they condense from 2 to 4 millimeters. Now I want you to take your hand and touch it to your nose and back to my finger. Okay, so cerebellar function is intact. I already, actually, can you squeeze my fingers with your hands? Good, so bilateral hand strength. And now some general questions, some history questions. Do you have any numbness or tingling?
No.
Any slurred speech or seizures?
No.
Dizziness, headaches?
No.
Any weakness?
No.
Any difficulty recognizing an object? If I were to put something in your hand, would you be able to tell it's like a paperclip?
Yeah.
Okay. All right, and finally, I'm just going to observe your gait. If you could stand up for me, and if you could walk. Hold on 1 minute. I'm just going to look behind you. Okay, walk in a straight line. Then walk back on your tippy toes and on your heels. Okay, so you have a steady gait, which is great. And then I'm just going to observe your spine really quickly. If you could bend over, touch your toes. Okay, so the spine is straight, so there is no lordosis, kyphosis, or scoliosis present. You can stand up and take a seat. I'm just going to briefly educate you on your blood pressure. So as we said before, and we have documented in the chart, that it was 125/85 millimeters of mercury, which is a little high. We consider that pre-hypertensive. As you said, hypertension runs in your family, so it's definitely something to look after. Typically, we do not put patients on medication right away. However, we are going to observe the modifiable risk factors, such as your diet, how much you exercise, and really put that into place, okay? So from now on, how often would you say you exercise?
3 times a week.
Okay. And do you say, would it be for like
an hour?
An hour. Okay. See, that is pretty good. I would recommend that you exercise at least 30 minutes, at least 5 days a week. Okay, that way we're going to lower the blood pressure a little more. But how would you say your diet is?
Pretty bad.
Okay, including, how often would you go to a fast food restaurant?
At least 4 days a week.
Okay. So we're going to really try and work on that. I'm going to give you a worksheet on paper with different diet options, including low sodium, low fat, except for the good fats such as avocados and almonds, really trying to lower your sodium intake to hopefully decrease that blood pressure. If you could make an appointment at the front so that we can have you come back in about a month and I'm going to observe it again, okay?
Thank you.
All right, if you have any other questions or complications, you can let me know.
Okay.
All right,
I don't have any.
No? All right. Well, thanks for coming in today,
Thank
Lindsay.
you.
Good to see you.
Good to see you too.
See you.